The Hershey Trauma, Readiness, Education and Training Program is the third National Guard location, the only one on the East Coast, to provide an immersive trauma training experience for National Guardsmen. Penn State Health Milton S. Hershey Medical Center is a great fit for this program because it's a level 1 trauma center for pediatric and adult populations.
Epinephrine vial.
The importance of this training is so that our National Guard medics and nurses have enhanced skills and have an opportunity to practice their skills in a medical environment so that they're able to use these skills when they are deployed.
This collaboration with the military is a privilege for everybody involved. It gives us the opportunity to live our values, which is serving our community. We learn from our military colleagues, and our military colleagues learn from us. This learning environment gives us the opportunity to make our trauma program better and better serve the citizens within the Commonwealth of Pennsylvania.
The first class is made up of local Air National Guard, 2 medics and 1 nurse. The nurse actually works at Hershey Medical Center in the civilian sector. They have been rotating through the emergency department, the surgical ICU, the neuro ICU, and they've also been riding with life-flying ground EMS.
At the capstone event, they'll be doing a mass casualty event where we will give a scenario and then they will take patients from a triage all the way through care and then medevac of those patients and casualties.
Another patient. Hey buddy, you all right?
As a nurse in the Pennsylvania Air National Guard, it was really great to be able to come into a facility that I've known well on the civilian side. I'm an employee here as well, but see different elements in the ER, in some of the ICUs, and even the pre-hospital that really allowed me to get hands-on training in a way that I don't typically get it on my day-to-day civilian job. But is very key to my military success.
I think being able to see how a trauma's run from start to finish, how it's actually supposed to look. Like, you can look at the theory and practice it in a simulation lab all you want, but to actually be able to see it and experience it yourself, I think was the best part.
From day one, we were very welcomed. The staff was great with us. Really helpful to help us know where we're going because we had no clue where we're going. Their trauma director spoke with us the first day. It was such a great experience with the staff. I have nothing but good things to say about them and the way they welcomed us into their house.
At the end of the training, I feel that this course went really well. Our first cohort of students were very experienced, so they were knowledgeable on what they needed coming into a trauma program. They gave us some really good ideas and feedback, and all the hospital staff that we've been working with is really collaborating well with us and trying to volunteer themselves and be a part of this program.